Mr Speaker, my question is to the Associate Minister of Health and asks, is he satisfied that New Zealanders have adequate access to affordable dental health care?
The Honourable Peter Dunn.
Mr Speaker, yes, particularly with respect to children and adolescents. I do acknowledge, though, that some adults struggle to afford dental treatment, but there are mechanisms in place to support low-income adults to access care when they need it.
The Honourable Jim Anderton.
Mr Speaker, does the Minister believe that dental care is more or less affordable under current economic conditions to New Zealanders on average or below average incomes?
The Honourable Peter Dunn.
Mr Speaker, what I can tell the member is that in terms of the affordability issue, we currently spend around $40 million a year providing hospital-level dental services and a further $56 million a year assisting people get access to the care that they need. And in the last year, to January of this year, some 73,000 odd people sought access simply through the Ministry of Social Development for the various services that they required. So I would suspect that overall dental care is affordable.
The Honourable Jim Anderton.
Supplementary, Mr Speaker. Has the Minister seen the results of the New Zealand Oral Health Survey published in December 2010, which shows that 44% of all New Zealanders are not receiving any form of dental care? And if so, does he think that that number is acceptable?
The Honourable Peter Dunn.
Speaker, I actually launched the survey results, so I've certainly seen it and I'm aware of its content. And what it shows is a number of steps that, for instance, could be taken by people to improve their oral health care. For example, around a third of New Zealanders don't brush their teeth twice a day. If they were to do so using a fluoride-based toothpaste, that would have a significant positive impact on their dental and oral health status.
The Honourable Jim Anderton.
Thank you, Mr Speaker. Has the Minister got any comment on the dental health status of New Zealanders and whether it has improved or worsened over the last 20 years?
The Honourable Peter Dunn.
Mr Speaker, the Oral Health Survey shows significant improvement in a number of areas since the previous survey in the late 1980s, but it does also raise some areas for concern, such as those that I have mentioned already, and these are matters that will be worked on. I might say also that one of the things I think it does raise is the relevance of a survey every 20 years. I think in such an important area as our oral health, we may need to look to more frequent surveys to assess what's happening.
The Honourable Jim Anderton.
Mr Speaker, can the Minister tell the House why dental health treatment is excluded from the public health system of New Zealand when reputable surveys show that the number of New Zealanders not receiving any form of dental care has increased from 33% to 44% in the last 20 years?
The Honourable Peter Dunn.
Mr Speaker, I said in one of my earlier answers that we currently spend approximately $40 million at the provision of hospital-level dental services, with the majority being targeted to people with complex medical problems or disabilities and those who need treatment for conditions such as cleft palate, cancer treatments, etc. So I don't accept the proposition that dental care is excluded. I also made the point that around $56 million a year is spent by way of the social welfare provision to assist those people who are in need get the dental care that they need. That's around $100 million a year. It's a pretty substantial commitment.
Question number 7, Joe Goodhue.